bleeding inside the body, although not seen, can also cause shock.
So do you think this is the kind of thing that could happen if you're out on a hiking trip in the mountains?
Very much so, yes.
Right, you could have several of these situations occur on a hiking trip, and it would be good to know what to do. So, and also because this is a class about teaching English as a second language, I want to take just a minute and look at probably one of the most important words in that section, and that's the word dehydration. So Alex, can you tell me what dehydration means?
To me, dehydration means not a lot of liquid in your body.
Right. And let's say, maybe Troy, if you could tell me, if you didn't know what the word dehydration meant, is there a way, a strategy you might have for looking at the different parts of the word to try to understand it?
Yeah, I guess I would break it down into smaller words. So I'd look at D and say maybe that's like without.
Right, exactly. So that's what I was going to let you know, that DE or D is actually a root from Latin. It's often a prefix meaning removal, separation from, or the negative. So the lack of hydration, which would be the lack of water. So you can apply that to lots of different words when you see DE at the beginning. Okay, so let's go on. Let's continue, and maybe if you could read, Troy, the next four signs of shock.
Signs of shock: weak, rapid pulse, more than 100 per minute; cold sweat, pale, cold, damp skin; mental confusion, weakness or loss of consciousness; blood pressure drops dangerously low.
Okay, and these are so important in diagnosing shock, especially if you're out in the woods, you don't have a doctor or a medical person nearby. I want to give you a little mnemonic physical way to remember these 4 important symptoms. So the first is, we're going to look at the weak rapid pulse, right? So you can test pulse with your fingers right there on your wrist. And then we're going to jump down to the bottom one, the blood pressure. Where do you test blood pressure? When you go to the doctor, where do they put it? Right, they check your blood pressure right here, right? So we go up the arm, blood pressure. And then if you have a cold sweat, right, your forehead, right? And mental confusion, right? Oh my gosh, I don't feel right. I might be going unconscious. Okay, so do it again. We've got pulse, blood pressure, sweat, confusion. Okay, so you can remember it that way with those 4 symptoms. Those are really important to look at. There, you got it, Alex. Yeah. Okay. So those are very important to look for. Okay, so now go down to the next, and we'll just read through those. What to do if to prevent or treat shock if you see it on a camping trip, or if you're working in a remote site. And why don't you take turns reading? If you can hold it between you, you can alternate the bullet points.
At the first sign of shock, or if there is risk of shock, loosening any belts or tight clothing the person may be wearing.
Have the person lie down with his feet higher than his head, like this.
Right, and there's an illustration there that shows that, yeah.
However, if he has a severe head injury, put him in a half-sitting position.
Stop any bleeding. Use gloves or a plastic bag to keep the blood off your hands.
If the person feels cold, cover him with a blanket.
If he is conscious and able to drink, give him sips of water or other drinks. If he looks dehydrated, give a lot of liquid and rehydration drink.
Treat his wounds if he has any.
If he has pain, give him aspirin or any other pain medicine, but not one with sedative such as codeine.
Keep calm and reassure the person.
If the person is unconscious, lay him on his side with his head low, tilted back and to one side. If he seems to be choking, pull his tongue forward with your finger.
If he has vomited, clear his mouth immediately. Be sure his head is low, tilted back, and to one side so he does not breathe vomit into his lungs.
Do not give him anything by mouth until he becomes conscious.
If you or someone nearby knows how, give intravenous solution, normal saline, as a fast drip.
Seek medical help fast.
Right, so when do you seek medical help fast?
must be the last one.
Right,
Should that
if
be
he's unconscious. Yes, you have a question?
I know the answer.
If he's unconscious.
If he's unconscious, yeah, you better seek medical help quickly. Okay, thanks so much for helping with our lesson today. Do you have any questions?
No, I learned a lot. Thanks.
Oh,
Yeah,
good.
learned a
It's
lot.
pretty graphic information, but pretty useful, I think, when you're in the woods. Okay, thank you.